Bismillahirrahmanirrahim. Hello and Assalamu alaikum. I'm Dr. Hamd, and today we are going to be discussing the histology of the adrenal glands. So these are my lecture slides on this topic, and our learning objectives for today are that at the end of this session, the students should be able to describe the basic structure and subdivisions of the adrenal gland and recognize them in the histological sections. So I'll be showing you the histomicrographs of the adrenal gland, and we'll be discussing the different parts of this important gland. We'll also discuss the basic structure and function of the major cell types and different zones of the adrenal cortex. Similarly, we shall describe the basic structure and function of the major cell types and different zones of the adrenal medulla. Also, I will be explaining to you how the vasculature of the adrenal gland is organized to allow communication with the gland and the rest of the body. And in the end, I'll be explaining a few disorders that arise due to disruption of the adrenal gland function. Okay, so you all know that the adrenal gland, also known as the suprarenal gland, these are paired structures which are small flattened endocrine glands lying on the superior pole of each kidney and embedded within the perirenal fat. They are called endocrine glands because they release their secretions, their secretory products into the bloodstream. And from there, the secretions travel to a distant target site and exert their action. Each adrenal gland weighs about 4 grams, and its dimensions are that it is 4 to 6 centimeters long, about 1 to 2 centimeters wide, and 4 to 6 millimeters thick. So the location you can see over here in this diagram, if you follow my laser pointer over here, then you can see this yellow structure lying opposed to the superior aspect or superior pole of the kidney. This is the suprarenal gland. This suprarenal gland is supplied by 3 arteries, which are named the superior, middle, and inferior suprarenal arteries. As you can see from this diagram, the superior suprarenal artery is a branch of the inferior phrenic artery. The middle suprarenal artery is a branch of the aorta, and the inferior suprarenal artery is a branch of the renal artery. The venous drainage of this suprarenal gland is by the single suprarenal vein, which drains into the renal vein on the left side. And in case of the right suprarenal gland, it drains directly into the inferior vena cava. Okay, now if we take a section of the adrenal gland, then we can see 3 significant parts, or we could say the 3 gross layers of the adrenal gland. The outermost is the connective tissue capsule. The middle one is the cortex, which is the larger part of the gland. It makes up about 90% of the weight of the gland. And the innermost portion that is known as the adrenal medulla. So these are the 3 parts of the gland which you can examine with the naked eye, and that's why I've mentioned that these are the 3 gross layers of the adrenal gland. Now, embryologically speaking, this adrenal gland is unique in that it consists of these 2 separate parts, the adrenal cortex and the adrenal medulla. These are functionally separate parts. Embryologically, they also have a different origin. But during the embryological development, at the later stages, they come to lie together. So if you look at the cortex, it is derived embryologically from the mesoderm, whereas the medulla, it is derived from neural crest cells. So embryologically, the origin of the adrenal cortex and medulla is different. Functionally, therefore, they're also different. But these 2 parts, they come together and form this adrenal gland in the location which is on the superior pole of the kidney. So let's just look at this adrenal gland over here and the 3 gross layers which I mentioned. You can see the outermost is the capsule, and then comes the adrenal cortex, and the innermost part, this is the adrenal medulla, right? And here, this inset over here is showing us the cells which are making up these different parts of the adrenal gland. So outermost is the capsule, and lying beneath it, this area which has been labeled for you is the adrenal cortex, and then innermost part is the adrenal medulla. The adrenal cortex itself is further consisting of 3 zones of cells: the outermost zona glomerulosa, the middle one, which is the largest zone of the adrenal cortex, is zona fasciculata, and then the innermost is the zona reticularis. So these 3 zones, zona glomerulosa, fasciculata, and reticularis, these are the parts of the adrenal cortex. First, we're going to discuss the adrenal cortex in detail. So in the adrenal cortex, the 3 zones, what are they and what is the arrangement of the cells in each zone? What do they look like? The zona glomerulosa, which is the outermost zone of the adrenal cortex, over here the secretory epithelial cells, their arrangement is as such that they look like spears. And this is why this is called zona glomerulosa, because you know glomerular means a spear-like or a circular appearance. Then comes the zona fasciculata. Here the cells look like rods because their arrangement is in columns. And you know the word fasciculus literally means column or bundle. The innermost zone, which is zona reticularis, over here the cells, their arrangement is in the form of a network. And the word reticulum means network. So here is the histomicrograph. This has been stained. The adrenal tissue is stained by hematoxylin and eosine. And here are the 3 zones. You can see the outermost zone of cortex is the zona glomerulosa. If you just follow my laser pointer, the middle zone of adrenal cortex, this here is the zona fasciculata, and then the innermost zone of the adrenal cortex, here is the zona reticularis. So you can see that visibly the arrangement of the cells is somewhat unique in every part of adrenal cortex. Here a special stain has been used, which is known as the Addison's stain. With the help of this stain, you can better appreciate the different regions. So over here, if you follow the laser pointer, you can see the capsule is stained in blue because the collagen is stained blue with the Addison dye. So the capsule over here is the part covering the gland externally. And just beneath the capsule, this area is the adrenal cortex. Then comes the innermost area, which is the adrenal medulla. If we were to magnify the adrenal cortex only, then on the right side, you can see that these are the 3 zones of adrenal cortex. The outermost is the zona glomerulosa, then the middle zone, which is the zona fasciculata, and then innermost zone, which is the zona reticularis. So here the 3 zones of the adrenal cortex, they are visible. They can be differentiated from one another because of the help of this special stain. The innermost area, which is the medulla, you can see over here, it contains this vein, which is the centromedullary vein, which eventually drains the blood from the adrenal gland. Now we come to these zones one by one. We're going to discuss them in a little detail. First, we start with zona glomerulosa. You know it's the outermost zone. It comprises 15% of adrenal cortex. The cells over here are pyramidal or columnar cells, which are arranged in rounded or ovoid clusters, and they're separated by the fenestrated capillaries. Now, by fenestrated, we mean that there are perforations in the capillaries, which speeds up the transfer of the substances between the cells and the capillaries. And this zone is responsible for the secretion of mineralocorticoids, principally aldosterone. So over here, this is a magnified histomicrograph. Then again, the special stain Addison has been used, and you can see over here the adrenal cortex. Which part? This zone, the glomerulosa. This is what we're focusing on. This is the zone we're talking about, zona glomerulosa. So you can see it is lying just beneath the capsule, and the capsule, it's got these collagen fibers stained blue with azan dye, and from the capsule, the delicate fibrous strands known as trabeculae, labeled T, they extend between these clusters or rounded ovoid arrangement of the epithelial secretory cells. So this is the zona glomerulosa containing these clusters of cells, and you can see these cells have comparatively less cytoplasm in comparison to the cells of the zone innermost to it, which would be the zona fasciculata. So this here is zona glomerulosa, and it is responsible for secretion of mineralocorticoids, principally the aldosterone. Aldosterone is a hormone which has the function of increasing reabsorption of sodium ions from the renal tubules. So this increases the extracellular fluid volume and also elevates the blood pressure. Simultaneously, this hormone aldosterone also promotes the secretion or loss of potassium ions from the renal tubules. The production of aldosterone from the zona glomerulosa of the adrenal cortex is primarily regulated by the renin-angiotensin system. And the effect of the adrenocorticotropic hormone, or ACTH, is minimum over here. Okay, now let's come to the zona fasciculata. This is the zone which is present on the inner aspect of zona glomerulosa, and it occupies about 65 to 80% of adrenal cortex. So the major part of the adrenal cortex, the larger part, is zona fasciculata. This has long cords of large polyhedral cells, 1 or 2 cells thick, separated by fenestrated sinusoidal capillaries. So here, the word sinusoidal means that these capillaries, they have an incomplete basement membrane, and there are also the clefts between the cells, facilitating the rapid transfer of substances between the capillaries and the cells. Also, the cells in the zona fasciculata have a unique vacuolated appearance. This is because of the large number of lipid droplets within these cells. And because of this very reason, these cells are also called spongiocytes. This is the zone which is secreting glucocorticoids, principally cortisol hormone. So let's look at the histomicrographs stained by azan dye. We can see the zona fasciculata of adrenal cortex. And here you can see there is a vertical arrangement of the cells. This arrangement is at right angles to the capsule, and the columns of cells may be, usually it's 1 cell thick. And if you look at these cells, they are lightly stained because of the vacuoles or vacuolated appearance. This is because of the washed out lipid droplets, and that is why these cells are also called spongiocytes. The zona fasciculata, is producing the glucocorticoids, mainly cortisol. Cortisol is the hormone which has the very important function of elevating the blood glucose levels by stimulating the cellular synthesis of glycogen. It has many metabolic effects in the body. Other than raising the blood glucose level, it also increases the rate of protein breakdown. It also facilitates the release of lipids from the tissue stores. And you can see that cortisol has these multiple effects. Some are anabolic and some are catabolic effects throughout the body. Okay, so the secretion or production of cortisol from this region, zona fasciculata, is primarily under the influence of adrenocorticotropic hormone, which is a pituitary hormone. Now let's come to zona reticularis. This is the innermost part of the adrenal cortex. The innermost zone, which is making up just about 10% of the adrenal cortex, cells over here have less cytoplasm, so they appear more tightly packed in a network of irregular cords interspersed between wide diameter capillaries. So here the cells, you can see that their appearance is as of tightly packed because of having less cytoplasm, and also they are darker staining because of the lipofuscin pigment, and of course they have fewer lipid droplets. This is the area where the weak androgenic sex hormones are produced, including dihydroepiandrosterone, which is abbreviated as DHEA. This is the hormone which is produced in the zona reticularis. Let's look at the histomicrograph of zona reticularis, stained again with azan dye. And over here, you can see that there are the cords of secretory epithelial cells. Their arrangement is in clusters of cords, and they're separated by these fine strands of stroma, as well as the blood capillaries. And this zona reticularis, these cells have less cytoplasm, fewer lipid droplets in comparison to zona fasciculata, and they also have the lipofuscin pigment. Because of this, the cells in this region, they appear to be tightly or densely packed. The zona reticularis is producing the androgen hormones, DHEA, and similar hormones, which are then converted into testosterone in both men and women. And this area, the secretion of this zone is also under the influence of the adrenocorticotropic hormone. The zona reticularis also produces small amounts of cortisol. Now, what type of secreting cells are the cells of the adrenal cortex? Remember, they're all steroid secreting cells. So these cells are specialized for lipid metabolism. Over here, what I'm showing you is an electron micrograph, which illustrates the ultrastructural features of a typical steroid secreting cell. Here you can see that this steroid secreting cell is intimately associated with the blood capillaries, and adjacent to the blood capillaries, the plasma membrane of this cell has many microvillus projections. Now, within this cell, you can see this prominent nucleus with one or more nucleoli, labeled NU, and a small Golgi apparatus over here, labeled GO. Within the cytoplasm, there are many lipid droplets which have been labeled L. And also you can see that there are numerous mitochondria labeled MI. So there are many mitochondria in the steroid secreting cell. And if we look at a higher magnification through the electron microscope, we can see that the mitochondria of the typical steroid secreting cell has unusual tubular cristae labeled CR. And also there is a well-developed smooth endoplasmic reticulum which has been labeled SER. We know that in the steroid secreting cell, the mitochondria and the smooth endoplasmic reticulum work in collaboration for the active steroid hormone synthesis. Cholesterol esters which are present within lipid droplets are liberated or released from the lipid droplets of the cytoplasm, and then they are used for the active steroid synthesis by the enzymes present within the mitochondria and the smooth endoplasmic reticulum. So now that we have discussed the adrenal cortex, let's come to the adrenal medulla. The cells of the adrenal medulla synthesize adrenaline and noradrenaline. These hormones, also known as epinephrine or norepinephrine respectively, are collectively called catecholamines. So here is the histomicrograph of adrenal medulla stained with hematoxylin and eosine. Look at the medullary region over here. If you follow my laser pointer, you can see that the cells over here, they are present as cores or clusters, and their cytoplasm is finely granular and slightly basophilic. M is the area which is the medulla, and the V represents these venous channels within the medulla. Eventually, the blood will drain into this larger vein, which was the centromedullary vein, which we mentioned before. Adrenal medulla produces the catecholamines. The catecholamines are the hormones which act in concert, you could say, together with the cortisol and other glucocorticoid hormones to prepare person for the fight or flight response. The cells of the adrenal medulla, they have a special unique characteristic. They resemble the sympathetic neurons, and they are stimulated or supplied by the preganglionic sympathetic nervous system neurons. And upon stimulation, these cells, they're releasing the catecholamines, that is epinephrine and norepinephrine. These catecholamines act along with the glucocorticoids to prepare the body for the fight or flight response. And a number of different events are going to take place for the preparation of the fight or flight response, which includes an increase in the heart rate, the cardiac output, also increase in the rate and depth of breathing. There's increased sweating. There is a vasodilatation of the coronary blood vessels and the blood vessels of the skeletal muscles. And also there is a increased dilation of the bronchioles, of the respiratory system. And also the fatty acids, they are released from the fatty stores. Of course, there is an elevation of the blood glucose. And you can see that all these effects are going to increase the maximum use of energy by the body, and they're going to increase the physical effort. They also cause the vasoconstriction of the blood vessels of the skin and the gut and decrease the urine production. So the catecholamines are essential whenever there is a stressful stimulus. They are released in large amounts. But remember that even under normal conditions, they are produced continually in smaller quantities by the adrenal medulla. Now, what are the hormones? So why are the hormone-secreting cells of adrenal medulla called chromaffin cells? Now, you must have heard or read somewhere that these cells of adrenal medulla are also called chromaffin cells. Why are they called chromaffin cells? Because when they're fixed in chrome salts, the stored catecholamine granules of adrenal medullary cells are oxidized to a brown color. So here is the histomicrograph showing the chrome salt fixation of the adrenal medulla. You can see the brown color over here of the secretory cells of the adrenal medulla. If you observe closely, if you follow my laser pointer, you can see that the cells of the region which contains granules of epinephrine, they appear slightly different from the cells with the granules containing norepinephrine. This is because the granules of epinephrine, they are less dense and smaller in comparison to those of norepinephrine. Ultrastructurally, the chromaffin cells are characterized by many electron-dense secretory granules, which are 100 to 300 nanometers in diameter. The granules of epinephrine-containing cells are less electron-dense and smaller compared to the norepinephrine-containing cells. So here is another comparison of a histomicrograph, which is stained by hematoxin and eosine. This is the region of adrenal medulla. You cannot differentiate between the cells which have granules of epinephrine from those which have norepinephrine. But if we look at this adrenal medulla through the electron microscope, we can see that the cells with granules of epinephrine are less electron dense and smaller in comparison to norepinephrine, which are more electron dense and also having larger granules. Now let's talk about the blood supply of the adrenal gland. The blood supply of the adrenal gland is by two ways. One is to the cortex through the short cortical arteries, and number two, to the medulla through the long cortical arteries. So these are two sets of arteries which are supplying the adrenal gland, the short cortical arteries and the long cortical arteries. Eventually, the medulla has a dual blood supply. So this is an important point to understand, that the adrenal medulla is receiving arterial blood from medullary arterioles in the form of the long cortical arteries, which are directly reaching the adrenal medulla. But at the same time, the adrenal medulla is also receiving venous blood from capillaries of the cortex, that is from the cortical sinusoidal capillaries from the adrenal cortex. Let's look at this simple schematic diagram to elaborate this point. This is showing us the adrenal gland, the capsule. This is the region of the adrenal cortex in green, with the three zones, glomerulosa, fasciculata, and reticulosa from the outer adrenal speck. And then this yellow area over here, which is the medulla. The blood supply, the arterial supply to be more specific, is in two forms, which is the short cortical capillaries, arteries. We should rather say arteries. And then these are the long cortical arteries, right? So short cortical arteries are entering the adrenal cortex. And you can see, if you follow my laser pointer here, the long cortical arteries, they are entering the adrenal medulla directly. So adrenal medulla now has a dual blood supply because it is receiving the arterial blood from these long cortical arteries, plus it is also receiving the venous blood, which is coming from the adrenal cortical capillary plexus. So the venous blood is also being poured into adrenal medulla. And here you can see that there is a mixing of these blood types, and then eventually the blood is going to be carried away into the central medullary vein. Now the blood output converges, to central medullary vein, which then becomes the suprarenal vein. And this will drain into renal vein on the left side or directly into inferior vena cava on the right side. Now, what's the physiological significance of the dual blood supply of the adrenal medulla? There is a physiological significance because hormones made by adrenal cortex, they regulate catecholamine production by the adrenal medulla. So the hormones of adrenal cortex will be transferred to the adrenal medulla, and there they will have an influence on catecholamine production. Now, what is that influence? The glucocorticoids produced in adrenal cortex will induce the enzyme known as methyltransferase. This enzyme then catalyzes the methylation of norepinephrine to epinephrine. The epinephrine-containing cells are more numerous in areas of medulla supplied with blood that has passed, therefore, through the cortical sinusoids. So the conversion of norepinephrine into epinephrine is stimulated or catalyzed by the enzyme methyltransferase, which is in turn induced by the glucocorticoids. The conversion of norepinephrine to epinephrine, remember, occurs only in the cells of the adrenal cortex. And the normal adrenal medulla comprises 80% of epinephrine secreting cells. So here is a simple tabular representation. These are also the diagrammatic representations of the long cortical arteries entering adrenal medulla and the venous blood coming from the adrenal cortex into the adrenal medulla. Eventually, this is a summary of the hormones which are produced. The zona glomerulosa is producing mineralocorticoids, fasciculata, the glucocorticoids, and it also produces a small amount of androgens. Reticularis primarily produces androgens and small quantities of glucocorticoids, and medulla produces the catecholamines. This is another table taken from Ross Histology, a text and atlas, and you can read these in detail. These are the major functions of the hormones which are produced from the adrenal gland. I mentioned a few of these functions. You can look at this table again and you can read all of these functions in detail. Now let's go talk about the regulation of secretory activity. I mentioned it before. The glucocorticoid secretion is under ACTH. The mineralocorticoid secretion is by renin-angiotensin system, and catecholamine secretion is regulated by the sympathetic nervous system. So this is a recall of those regulatory systems. In the end, I would like to talk about disorders of adrenal cortex, a few disorders that you should be familiar with. The first thing is adrenocortical insufficiency, also known as hypoadrenalism. This is usually autoimmune in origin, and it is clinically known as the Addison's disease. So the salient features of Addison's disease is that since there is going to be a deficiency of the hormones, that is going to produce an adrenal crisis. Adrenal crisis is because of the lowered serum levels of sodium ions and increased serum potassium because of the deficiency of aldosterone. This causes a lowered blood pressure, causing vascular collapse, renal shutdown, and also you can see the associated disturbances, which is the pigmentation of skin and redistribution of body hair, all of these symptoms and signs which will be appearing in the body. Hyperadrenalism. Now, this is the excessive functioning of the adrenal gland, which can lead to either Cushing's syndrome or Conn syndrome. Cushing syndrome means an excess secretion of glucocorticoids, whereas Conn syndrome is due to excess secretion of mineralocorticoids. So first, let's look at the mineralocorticoids. Their excessive secretion, that is primary hyperaldosteronism. It can be due to a tumor within the adrenal gland, that is the aldosteronoma, and the treatment would be surgery. It can be due to bilateral adrenal hyperplasia. In that case, there is the treatment which is long-term treatment with spironolactone, which is the potassium-sparing diuretic. So this is in case of the hyperaldosteronism. Whereas Addison's disease, which is due to the chronic adrenal insufficiency, in that case, the treatment would be steroid replacement therapy for life. I would like you to know and understand what is the difference between these two terms, Cushing's disease and Cushing's syndrome. Both conditions involve too much cortisol in the body. But what is the difference? The difference is that Cushing's disease is specifically due to a pituitary tumor, which then releases excessive adrenocorticotropic hormone, and that in turn stimulates the adrenal glands to make more cortisol. But when we say Cushing's syndrome, remember that can be caused by various factors, such as medications, pituitary or adrenal tumors, or genetic mutations. So Cushing's disease, you could say, is a specific type of Cushing syndrome, and also it is the most common form of the endogenous Cushing syndrome. Whether it is Cushing's disease or Cushing syndrome, the high levels of cortisol are going to produce multiple effects on the body. Since cortisol suppresses the immune system, it is anti-inflammatory that causes an increased susceptibility to infections. And then fat deposition on the face causes a characteristic moon or round face. And there's fat deposition also over here in the shoulder region, causing a buffalo hump, and in the back of the neck. And also you can see the purplish stria on the abdomen. There is fluid retention, central nervous system irritability, hyperglycemia. So there is a whole spectrum, a range of signs and symptoms due to the elevated levels of cortisol. And when we come to adrenal medulla, the disorder I would like you to be familiar with is pheochromocytoma. Pheochromocytoma is a rare tumor derived from chromaffin cells leading to excessive catecholamine secretion. The high levels of catecholamine, they produce these three symptoms which are easy to remember from the word pheochromocytoma. The first three letters, you can use that as a mnemonic: P-H-E. P is for palpitations, H is for headache, and E is for episodic sweating. So the sweating and the headaches and the palpitations, these are the characteristic presenting complaints or symptoms of a tumor in the adrenal gland, which is causing an excessive catecholamine secretion. So if we have the Addison's disease, patient with Addison's disease, and there is degeneration and cell loss in the adrenal glands, fludrocortisone is treated, is given to treat the patient, which is a mineralocorticoid. And response to this drug indicates that the region of the adrenal glands involved is, of course, zona glomerulosa. This is a diagram which I showed to you before, and you should be able to easily label it now. Number 1 is the adrenal. 1 is the answer to this question, that it is the adrenal gland. And you know 2 is the capsule. And 7 is this innermost part, adrenal medulla. The middle portion, which is number 6, is adrenal cortex. And it is subdivided into these 3 regions or zones from outer to inner aspect: zona glomerulosa, fasciculata, and reticularis. So this concludes with today's lecture. Our topic was the histology of the adrenal gland, and the source of this lecture I have shared with you in this last slide. The micrographs and the tables, they were taken from these books of histology, and I hope that was a concise lecture, and I was aiming at covering the most essential and basic aspects and discussing them with you in detail. For further lectures on histology as well as embryology and gross anatomy, you can follow my page on AnatomyMentor, Facebook, that my page is AnatomyMentor, and you can also like and subscribe to my YouTube channel, which is by the same name, AnatomyMentor, for further videos. So thank you and take care and stay blessed.